We have these wonderful people with us today that I'm going to introduce you to. And I'm going to start with Mike Kessel. Mike is President and CEO of Cleveland Clinic Canada. He's an executive with more than 20 years experience in strategy, finance, operations, and entrepreneurial activities, but he does so much more. He works as a volunteer on the board of the Heart and Stroke Foundation of Ontario. He's a member of the International Chief Executives in Canada Committee of the Conference Board of Canada. I had to cheat to look at that one, Mike, there. And he's an active member of Young Presidents organization as well. We stole him from the US, from Chicago, where he was an executive at Northwestern Memorial Hospital. He was instrumental there in the development of network of executive health and wellness programs with leading medical centers throughout the United States. And that program was actually ranked as one of the top programs by Forbes and Fortune magazines. Besides his talents on the soccer pitch and tennis courts, he was a nationally ranked table tennis player. He likes to call it ping pong in the US. And because of his love of this and because of his incredible volunteerism, he is one of the leading, correct me if I'm wrong, he is one of the leading fundraisers for heart and stroke with his Cardiac Smash, which is a ping pong or table tennis tournament that he's taken across the country. And it's been incredibly successful. He came here in 2009, so he's been here at Cleveland Clinic for 10 years. He didn't know his soul when he came. He came with his family and he didn't know anyone, but now he knows everyone. And he's an incredible networker, but he's an incredible networker because he's just such a nice guy and he's very smart. So welcome to Mike.
Well, geez, my mom couldn't have put it any better than you, Cathy, so thank you.
Well, there you go. And I'm also going to introduce Meegan. And Meegan is another steal from the US. She's Vice President of Communications and Strategy at Cleveland Clinic Canada. As part of the clinic's leadership team, and she's been part of it for 11 years, she's been responsible for brand awareness, strategic partnerships, patient education, service line growth for the organization as well. And she has a passion for helping people live healthy lives. For over 20 years, she's been involved in the healthcare industry, particularly in the area of cancer, and has done some major jobs in cancer, including she's Senior National Marketing Manager for the Canadian Cancer Society and Brand Manager for Cancer Treatment Centers of America, which is a network of cancer hospitals based in the US. She graduated from DePauw University in Indiana with a degree in anthropology and art. She's done management training programs. She's an active supporter of women in business and in the arts community. And she is a kind and thoughtful leader to all of us. Welcome to both of you. It's so exciting to have you. And you've both provided incredible leadership to us all at Cleveland Clinic. We're very grateful. A lot of people don't know this, but you've kept the Midtown and the downtown clinics all working at this time, which is amazing. I don't know how you do it. You've remained incredibly calm through this COVID. And I like to say that you've turned lemons into lemonade. We're all doing different projects and jobs and discovering our potentials in other areas. So we're very grateful and I wanted to thank you.
Well, thank you for hosting.
Today's topic is leadership. Finally, I'm getting to leadership. So leadership, especially during COVID. And first I wanted to say welcome to both of you. It's so great to see you. And I also wanted to ask you each first how you're doing, and finally, if you can think of one positive
Mhm.
situation or one positive thing that has come out of COVID-19
Mhm.
for you each, maybe starting with Meegan.
Thanks, Kathy. I love any excuse to get together with you and Mike, so I was happy to be here. A positive thing from COVID. I would have to say that just being able to get to know people on a deeper level, like this is unprecedented times, and we're finding ourselves literally in the living rooms of colleagues and partners. We are meeting their children and their families. We're seeing them in casual clothes. It's just we're breaking down barriers in a way that we hadn't before in the professional environment. And I feel like it's helping us to build deeper relationships. And I think that this time of vulnerability is going to end up benefiting how we are with each other.
Great, good. Mike?
Yeah, I guess I'll share. I think that's great. I'll share maybe one personal and then maybe one, I guess you would call business. I think the personal, I'm married. I have 3 great kids, an awesome wife, and I typically would travel before this 1 to 3 times a month. So I'd probably be out of the home maybe 30% of the month, if you will. Now I'm home all the time, and I get to have dinner with my family. I get to see my kids. I get to communicate more with my wife, and kind of how it used to be many years ago. Which I'm a little bit old-fashioned in a number of my things that I do. So that for me personally has been great. I think from the professional standpoint, the positive thing here is. I'm a fan of complexity, change, and puzzles, and I think if you like those 3 things, I think it's actually brought a whole new level of transparency to the equation, truly showing who the leaders are in the organization that embrace complexity, change, and puzzles, and who's proactive, who's reactive. I'm a big fan of ambition and drive in healthcare. And I think we have a lot of that on our team, which I'm proud of. And I think it's exposed in a short period of time, those individuals, which I'm grateful for.
Excellent. Great answers from both of you. We started today and we were talking about leadership, and I've shown here Sheryl Sandberg's quote, and as some of you know, she's an executive with Facebook. They've done pretty well. And this quotation on leadership, if people take a moment to look at it there, it really sounds a lot like coaching to me. And I would ask, do you see yourself as a coach when thinking about your leadership style? What would you say to that, Mike? Starting with Mike.
Yeah. So yeah, I think I do see myself as a coach, and I think my style. I know there's a number of folks on this call from our organization. Hopefully, they would agree with this. I would say it's a little bit more collaborative, where kind of being hard on the issues and soft on the people is something that was taught to me at a young age, and I hopefully have kind of carried it on. So yeah, that would probably be my style. More collaborative, I would say, and very extremely empowering.
And have you had a coach or a leader in your history that you would look to and say they were a great leader or one of the best coaches I've had because of this quality? What would you say to that?
Yeah. I'll tell you, I love our current global CEO, Dr. Tom Mihaljevic. Preceding Tom was a gentleman by the name of Dr. Toby Cosgrove, who's a cardiothoracic surgeon, and he taught me a lot. And while I didn't spend a crazy amount of time with him, given he's in the U.S. and I'm here, I spent enough. And he was direct, he was succinct, highly intelligent. I think he was extremely supportive of me and of our organization in Canada. He's very responsive. And I remember, I have very fond memories of him, and where I would email him and I'd say, hey, why don't you come to Canada and give a presentation? The Ontario Hospital Association has a group of 300 leaders, and they'd love to hear from you. Will you come? And in the drop of a hat, he said, I'd love to come. He'd fly here. We drive together, spend 2 to 3 hours going from Pearson to Blue Mountain. He'd give the presentation. I'd drive him back to the airport. And those are the memories that I have, and very positive influence on me and my career.
And if I recall, he was very clear in his messaging as well. And I remember you saying that when you went for your final interview, that his message to you was, you said if there was one thing, and it was that patients come first.
Yeah. So that's, there's, I'm very proud to say, I certainly, as you mentioned, I have formal training. My academic training is in strategy and Big Ten schools, Ohio State, Northwestern in the U.S. But when I joined this organization, the thing he said to me in the interview, he said, you have to care about one thing. You have to care about the patient, and then everything else will happen.
Mm-hmm. Yeah. Great suggestion.
Yeah.
Meegan, what would you describe as one of your top leaders or coaches that you've had in your life? And were they a coach? What did you learn from them? And what was the takeaway?
It's interesting when you step back, you realize how many coaches you did have. And I feel very grateful for it. I've learned stuff from you, Cathy. I've learned obviously stuff from you, Mike, working closely with you over the last 11 years, and I'm grateful for both of you. I also, when I sit back and think about where in the recent decade, let's say, who's had one of the biggest impacts, it would have been, it's one of my mentors. Her name is Lisa Lisson. She's the president of FedEx Canada. I happened to cross paths with her by attending a Women's Executive Network event about women in leadership. And during that session, something really clicked with me. And it was how she was talking about being a good-hearted leader, and that there is actually a place for kindness in business. And up until that point, I received feedback in my career that my kindness, my compassion may be perceived as weaknesses for my career growth. And it really resonated with me that, oh, wait, there's a different way to lead than other leaders I had seen. And so I mustered up my courage, and I reached out to Lisa and asked her if she would meet me, and as I mentioned, became my mentor. And I just really got to learn from her how she used kindness in business. And I get to see Mike demonstrate this quite often within our organization. He does fall into the category as a good-hearted leader, as Cathy, as you've already said. We have many conversations around doing the right thing. And I think it's so important to have that lens in how we lead. Are we doing the right thing? And it's just asking ourselves that. And then just asking ourselves, are we showing up how we want to show up and being good people? I think that's really important.
And perhaps maybe it's a little bit easier because we're in healthcare. Mm-hmm. To me, it seems almost obvious that we have to do the right thing, and you have to care, and and you hope that gets translated into the business community as well. And you guys see that more than I do, being a physician and working with patients. But I hope that some of your kindness goes to the business leaders around you that you work with. One of the areas in my reading, they talked about, and we're not going to go through all 10, but they talked about 10 characteristics of a good leader, and they list here integrity, ability to delegate, communication, self-awareness, gratitude, learning agility, influence, empathy, courage, and respect. And if you, I'll put you on the spot and say, if you were to pick 2 of those areas that sort of resonate to you, especially now during COVID, in terms of what's needed in leadership, which 2 would you pick out? And perhaps I'll start with Meegan again, and then go with Mike.
Oh, only 2. Okay. So I would definitely pick communicate. I think, especially during a time like this, you need to communicate often. You need to communicate clearly. Even if you don't have all the answers, communicate. I also think it's really important for us to communicate the why. Just because we know why doesn't mean everyone else knows why. And I think that's really important during all times of leadership, but especially right now. In a second. I would pick gratitude. And I would say that everyone deserves to and needs to be appreciated. And sometimes when we can get really busy, we can overlook doing that. And I think it's really important to pause and to express gratitude. And not when that huge project that has taken months gets completed, doing it along the way to know the efforts people made are appreciated.
Mm-hmm. The communication is so important, and you guys have done it really well. I know that we're getting lots of, we have Zooms and emails, and Mike's been doing these town halls, and, we're all off-site and we're all at home working, and it helps to pull us in and keep us part of the team. And we'll talk more about teamwork later, but great points. So Mike, what are 2 of the, that you would pick out, especially now?
Yeah, it's a really good list. I like this list. I mean, what jumps out to me are I have 2, and then I'm going to cheat. I have a third. So the 2 that jump out for me by far are integrity and empathy. And I think I want to sleep at night, and I think doing the right thing and putting, as we talked about before, healthcare and the patient first. Which enables an organization to succeed. That's kind of my guiding light, and so my North Star, so to speak, here in Canada.
Hi.
Hi. It was
Working from home.
Yeah, that's great. That's the joys of Zoom, right? That's the joys of what we're doing. So I think those are the 2, but I would also say for the folks on this call that are kind of growing leaders and growing managers, I think the thing that's really helped me throughout my career has been in my life is the other category there, which they call number 6, learning agility. And why I bring that up as kind of a close, kind of a third, if you will, is I've always tried to pick up one new skill each year to kind of better myself and to kind of intellectually stimulate myself. And so for any of the Cleveland Clinic candidates on the call right now, they may know this, but last year it was going back to school, University of Toronto at night to try to learn Mandarin. And so I did it for a couple quarters and really enjoyed it. It's a very difficult language, but I think it's that idea of learning and being curious. So those would be mine.
Good stuff. Now, one of the points on the list is self-awareness. And I've heard Meegan talk about self-awareness, and it is one of the characteristics on the list. So Meegan, I'm going to pick on you again. How is this relevant? How is self-awareness relevant to you, especially at this difficult time through COVID?
Yeah, it's critically important. it's required for all of us, regardless of your position, to grow personally and professionally. It's also hard. It's hard to remember to slow down and be self-aware. It is a skill we constantly have to work at. And the thing is, you may feel like you've mastered it, then you evolve and you have to become self-aware again. So I think it's really important. I think it's that, you know, someone might say, how do you even start doing this? I think it's asking yourself, like, what are my values? How do I want to show up? And you can, again, professionally or personally, and then checking in with yourself and others to say, am I showing up that way? I've said I want to show up that way, but did I just walk out of that meeting in showing the values that are important to me? Did I behave in a manner that I want? Are people responding to me in the way that I hope that I'm coming across? So it's getting feedback at all levels of the organization. That's what's really going to help us be aware and make sure that we're developing in the way that we want to. And as Mike said, that we want integrity, we want to sleep at night, and showing up in the way that you want to is what will get you there. So I definitely think it's a helpful tool right now. You can learn a lot.
Thank you. The Lolly Daskal is an executive coach and a well-known business person, probably to you guys. And she talks about the best leaders, like the best coaches, give those around them permission to succeed and know how to help them reach their potential. I realize that a great leader wants, you know, really everything that the great coach wants, which is for the athlete or employee really to be their best selves and to be the best that they can be. She also goes on to describe other characteristics of good leadership as well. So I didn't put 10 down, but I picked out 2 for each of you that I thought, knowing you, that you could speak to and that would ring true to you. And starting with Mike, one of the things that she spoke about in the article was challenge the unchallenged. And we often hear people say, you can't do that, or that's not possible. And one thing I know and love about Mike Kessel is that you don't like those answers, and you like to challenge assumptions. So perhaps you can give us an example of your leadership and how you have challenged assumptions or the status quo.
Yeah, I think that's appropriately said. I'll actually give you 2 brief examples. One is, yeah, I'm not a fan of you can't do it, it's not possible. And so I think one example would be with a new service we started offering 5 years ago called the Corporate Medical Directorship Program, where we basically combine a McKinsey consulting type mind with a clinician, and we basically provide a medical director to organizations that want to protect enterprise health risk. And it's basically a gap that we noticed in the market that needed strategic clinical insights at the leadership table of these big companies making big decisions about people. And so we noticed this, and I think if it hadn't existed anywhere in the world, and this is something that we pushed on, that there's a space for this, there is a market for this, and it's the right thing to do for the enterprise and the health and safety of all the people that work at these organizations. And so that's one example where we pushed it, and it's been incredibly successful, and I've been really proud of our team. We've got close to 20 docs now doing this work, really important work, and we've gotten great feedback. The other thing I would say is, this whole idea of the labor force and turnover. I think years ago, 10 plus years ago, there was high turnover at Cleveland Clinic Canada. And it was really important to kind of, to me, to kind of settle the ship where we can get turnover down to 3% or lower. And our team did a wonderful job. And I bring it up as challenging the unchallenged because I think there's this mindset out there that people have to move jobs all the time to get promoted or to make more money or all that kind of stuff, if you will. And I think, why not, for people that work with us, why can't they retire as Cleveland Clinic caregivers? And so that, I think, leading an effort to provide for our caregivers and create a great internal environment has been really important.
Great work, Mike.
Thank you.
Also, I wanted to mention that if people have questions for Mike or Meegan, they can also write in on the chat, and I will look at them now or in the Q&A section at the end. So another point that I found was recognize potential. And Meegan, this is another characteristic of leadership that this person spoke about. Can you give us an example at Cleveland Clinic, Canada, where we've been using this during COVID?
For sure. I think, Cathy, you are a perfect example. By day, you are one of our most beloved physicians for our patients. Now you are a celebrity talk show host. And then moonlighting with our corporate medical director program to support them on some best practices and return to work. So we recognize the potential in you, my dear. And I think that's what it is. I think it's all about paying attention, observing, listening to our team of what they enjoy, what motivates them, and trying to match that. And it's been a real honor to be a part of the clinic during this time. Here locally are 185 caregivers and how they've come together, how we've redeployed people with the primary focus of how do we help patients, how do we support each other, and then also being a part of 67,000 caregivers globally and seeing how we adjusted in a time like this. There's been so much potential recognized, and we've learned from a lot of it too. So that's, I think, will be a good thing that we'll take forward about how to leverage talent within the workforce.
Well, and it's been great for all the people at Midtown and downtown as well. You've kept us going through this and also given us all new challenges. I mean, everyone's doing different things. And as I said in the beginning, we're all really appreciative for sure of that. This one, Mike, I had to pick for you for sure. and this one it's another point from this Lolly Laskell from the article that I mentioned earlier, was to invest in teamwork. And team being together, everyone achieves more. It's so I know you're a big sports fan, so I picked this one. And you actually say that healthcare is a team sport. It's one of your quotes. And so I had to pick out this this picture because it was from a World Cup in Jordan a number of years ago. I do some work for FIFA. I'm a medical director. And this particular one, I took a bunch of novice physicians who hadn't been even to a game before. And I had to teach them how to carry people off the field. And it sounds like a no-brainer. It sounds like an easy thing to do. But all you have to do is Google stretcher bearers on your internet and see the disasters that happen. So anyway, I took these lovely women and we taught them how to do that and to do some other things as well. And it's so important, the team approach is so important to do things effectively, efficiently, and also safely. So it just represented the teamwork and team, the importance of teamwork in this. Can you reflect on the teamwork at Cleveland Clinic that you've seen, especially during COVID, and give examples from that?
Mm-hmm. Yeah, you're absolutely right, Cathy. Healthcare is a team sport, and I have to tell you, back to some of the earlier comments around serving leader, and that it's not about me, right? And it's not about us individually. It is all about the team. It is all about removing obstacles in other people's ways to make them better, and so that they can be optimized. And while it's great that maybe I'm a high performer and I'm learning and I love my job, it's all outstanding. But what actually matters 10x more, I would argue, is how many people in the organization really believe in a team philosophy, and it will buy in to the vision, the purpose of the organization. And with that being said, I think, to me, I smile and I'm happy when other people are demonstrating team behaviors and are communicating amongst themselves and smiling and laughing and helping each other out. And so I have an example, and we have an incredible group of caregivers at Cleveland Clinic Canada, very proud of. And this was, I didn't get permission for this, so I won't identify one of the individuals, but one of our physicians sent a note to me about another physician. And that physician, and this just makes me smile, sent this note. Today, she had 2 of her 5 patients cancel and insisted that she see one of mine so that we both had 4 patients. This is despite her having had a very busy and stressful week. When I told her that I was fine to see all 5, her response to me was that we are a team and that there is no I in team. I was reminded today how wonderful it is to work with someone who always goes above and beyond. What a great team member. We are so lucky to have her. And that was another physician talking about you, Cathy.
This is going to sound like a setup, this whole.
Yeah. And I know,
I didn't know that was coming.
I know you didn't know that one was coming, but I have at least one doozy in there for you.
Well,
and so,
that's a doozy.
And that exhibits the point that it's not about me, right? It's about all of our other people.
Well, the other thing about teams and working on teams is, you didn't leave the field until everyone could leave the field. Like be first there, but you don't leave first, you leave last, And I think that carries over in all aspects of life, or should. It's a better world if everyone does that. So thank you for mentioning that.
Of course.
I'm going to go on. So Meegan, I know that you and Cleveland Clinic have encountered many problems and issues for sure during this COVID-19. You're, however, amazing at providing solutions. So I've heard you say, don't just bring the problems, bring the solutions. And can you give us some examples of how you use this characteristic or quality at Cleveland Clinic?
Sure. It's really easy to identify problems. There's a lot of them. I think if we just asked all of us, write down 10 problems, you guys could do it in less than 60 seconds. That's not the challenging part. But what the important thing to do is to provide solutions. Because if you care enough about the problem you're identifying, you're going to spend time to think about the solution. And especially if in a professional environment that you want actually real change to happen, and you need to share it with your manager or present it to an executive team, they don't need to know the problem, they need to know the solution. How can you help provide some of those ideas to actually see real change happen? Because a challenge in organizations is that there's a lot of problems and they've been identified. They don't have people that are bringing ideas on how to solve them or raising their hand to say, hey, I'll do that. So I think it's so important for all of us, even within your teams, with it, and or helping other teams to say, hey guys, I've noticed this. Have we thought about X, Y, or Z? Do you want to sit down together and come up with ways that we could probably do this differently? I think if we all started to do that more and take ownership of these problems and solutions, I think we'd all be, we'd get a lot further.
Excellent, excellent advice for sure. Our time, we still have about 4 minutes left, and I'm waiting to see if there are any particular questions, but I did want to ask Mike, in our remaining 4 minutes, what does the future hold for Cleveland Clinic Canada? And are there any final tips or comments on leadership that you would like to make at this time? And we can get Meegan to chime in on that too, if she has any final thoughts.
Yeah, I would say from my lens, I mean, our future is extremely bright because of our hundreds of caregivers and the 70,000 people globally that have kind of put their hearts and minds into this organization over the last 100 years, essentially, and the last 14 years here in Canada. So I'm very optimistic that we are a resilient organization that will thrive, and I think our team is setting us up to thrive right now. I think in terms of my final thought, you know, I have to tell you, and it's going back to authenticity and kind of realness, and empathy leads the way. I'm going to share one last email I got, and you did not know I was going to read this either, Cathy, but I thought it's very appropriate because it made me smile. This is from a patient. I have been visiting Cleveland Clinic for the last 6 or 7 years for my annual health checkup. I was there today for my visit. This is the first time I had the opportunity to meet Dr. Campbell. She's not only a consummate medical practitioner, but also a truly caring and compassionate person. I haven't seen a doctor like her in a long time who is genuinely considerate of patients' needs. In a customer-pleasing culture of ours, it was pleasant meeting someone who was so genuine. Now, you responded, okay? Dear Mike, thank you so much for sharing his comments. It means so much to me not only relate to patients, but also to put my heart into my care for the patients. It is very satisfying to hear that I connect and have a meaningful relationship in our brief interaction. I feel that coaching is one of my strengths, and he needs a lot of this. To have a patient spend the time to relate this experience to you is very moving to me and makes my day, because it makes me feel that my comments have resonated. So why am I telling this story? Obviously, it's a great story about you. However, I feel in leadership, if I've done my job as a leader, empathy, authenticity, it's not about me. It's about everybody else. And when I hear those stories about everybody else, you included, that's what travels fast. And that's the reason I think, have done a great job here in Canada. So that's my final thought.
Wow, thank you, Mike. Supposed to be the other way around here. Meegan, any final thoughts before we say goodbye to everyone? Thank you, Mike.
For sure. I would just add 3 things to leave people with. 1, think differently. Times are different. We need to really challenge how we work, what needs to be done. I'd also say delegate. Like many of you, I'm sure overnight you became full-time teachers, potentially full-time parents, as well as full-time employees. Delegating will help you achieve your goals, keep you sane, as well as develop others. And then just lastly, be kind. Be kind to yourself, be kind to others.
Well, I'm going to sign off, but I wanted to thank both of you so much for coming and sharing your thoughts on leadership. Next week, we're going to have a return to play, a return to sport talk, and lots of interesting discussions. So hope to see you next week. So thanks, everyone.
Thanks,
Thanks,
team.
Kathy.